I've been doing uterine fibroid embolizations for over 22 years, and it's been a major part of my practice for probably the last 15 years. It's been one of the most satisfying aspects of my practice to date. Treating these patients and giving their lives back is one of the most rewarding things that we do, actually. Many patients wonder how uterine fibroid embolization works. It's fairly simple. Fibroids are very vascular tumors that require blood flow to grow and survive. How we shut the blood flow down to the fibroids is fairly easy. We thread a very tiny catheter into an artery of the body. The catheter is actually so tiny nowadays, we typically insert it through an artery in the wrist, find the blood vessels supplying the fibroids, inject these tiny particles that float downstream, and permanently shut down the blood flow to the fibroids. Afterwards, the fibroids shrivel up and the symptoms are typically gone in 2 to 3 months. In order to be a candidate for uterine fibroid embolization, the patients need to have fibroids, obviously, but they also need to have symptoms. Only about 35% of women actually have symptoms. If you don't have symptoms, any treatment is not going to make you feel any better. So women with fibroids that have symptoms, we typically would do an MRI exam to make sure that the fibroids have good blood flow going to them. Most fibroids that have good established blood flow would be candidates for this treatment. The risk of uterine fibroid embolization, very low if you go to an experienced operator. Some of the risks you worry about are infection, fibroid expulsion, damage to adjacent structures, which is called non-target embolization. If you go to an experienced physician who has done a lot of these, that's really not something that most patients need to worry about. In our practice, patient safety and comfort comes first. During all of our procedures, we actually have a team of board-certified anesthesiologists who provide moderate sedation throughout. We also have developed a fairly detailed pain control algorithm where patients have minimal pain after the procedure. After uterine fibroid embolization, most patients are back to normal activity and back to work 7 to 10 days after the procedure. Some women actually go back to work sooner, but 7 to 10 days is about average. Fertility and pregnancy following uterine fibroid embolization is a complex subject, and it really depends on each individual clinical situation, including how many fibroids you have, your prior pregnancy history, and it's something that's not easy to answer for all patients. Every patient is different, every clinical scenario is different, and patients really need to speak to their doctor directly about their individual situation. Following uterine fibroid embolization, patients can get pregnant afterwards. In a large meta-analysis comparing patients with fibroids divided into 2 groups, one group having uterine fibroid embolization and one group having nothing done, the fertility rate actually was essentially the same. So in most patients, you can become pregnant afterwards, although we ask people to wait at least 3 to 4 months following uterine fibroid embolization to attempt pregnancy. In performing uterine fibroid embolization for over 22 years, a number of advancements have been made in the procedure to make it what it is today. Number one, the equipment is much better than it used to be. The catheters are smaller, the coatings are hydrophilic to where they can go into smaller vessels with ease. Also doing procedures now with radial access. Instead of going through a groin access where you have to lay flat for many hours afterwards, we were able to thread a very tiny catheter through an artery in the wrist. When we do the procedure, after the patients wake up, they can get up and walk around right away. Also, the treatment has evolved into an outpatient procedure primarily because of the way we're able to control the pain afterwards. Over 20 years ago, we admitted all these patients to the hospital. They needed a pain pump overnight because there was a tremendous amount of pelvic pain they had afterwards. With the treatment regimen and the pain control regimen that we have come up with, most patients have little to no pain the day and the evening of the procedure, and they're able to start resuming light activity around the house the very next day. Some of the myths that we've encountered in performing UFE and in dealing with patients with fibroids, number one is not all fibroids need to be treated. Unfortunately, I have many patients come through my door on a monthly basis where we're told they had to have a hysterectomy because fibroids were discovered on an ultrasound. I ask these ladies, what are your symptoms? And they say, I have no symptoms. No bleeding, no pain, anything. I said, well, you have no symptoms, you don't need to have any treatment. That's the first myth. The second myth that I think I experience quite frequently is other doctors tell patients that uterine fibroid embolization won't work for larger fibroids. That's not true. UFE works really well for larger fibroids with no increase in complications. Probably the third most common myth I hear about UFE is that you cannot become pregnant afterwards. That's not true at all. In a large meta-analysis, it was found that fertility rate after UFE was essentially the same as patients with fibroids who had no treatment.